Hi, everyone. Thank you for participating in this year's virtual student event hosted by IPHCA, Understanding and Serving America's Underserved. I am here with one of our guest speakers who has agreed to join us to talk about her experience working in an FQHC, what she enjoys about working in an FQHC, and just any kind of advice that she has for students who are thinking of pursuing this as a career. So I will let you introduce yourself.
Sounds good. My name is Samantha Thompson. I am a PA at PrimeCareHealth, which is an FQHC in Chicago. I am also our MAT director, or medical director of our addiction services within PrimeCare. I went to school at Northwestern University and graduated in 2017, and I participated in IPHC as well, and I've been with my current company since I graduated.
Very cool. And something about you, Samantha, is that you are the MAT director, correct? Or I may not be exactly stating your title correctly.
Yeah.
But I imagine that were you hired in that role immediately, or did you sort of advance into that role? Tell me about how you got into that position.
That's a great question. So I was not hired into that role. I did not have any experience with treating addiction or opiate use disorder, which is primarily what we treat in our MAT clinic. About 2 years into working at PrimeCare, I developed an interest in addiction medicine, and I reached out to our MAT director at that time, who actually trained me in being able to provide those services. And I did my own training, outside of work to get my X waiver to be able to prescribe buprenorphine, which is primarily what we use. And from there, I started doing a MAT session about once or twice a week, and had more and more interest in addiction medicine. So my MAT director also connected me with a fellowship opportunity at Rush University for addiction medicine specifically. So I did a little bit of extra training in a 9-month fellowship at Rush. And then just this year, I applied to be the MAT director after my prior MAT director left to move out of the country to go back to where her family primarily is located. So I'm somewhat new to the role, but I've been in addiction medicine for a couple of years now.
Congratulations.
Thank you.
So now I would like to know, we've kind of talked about what you're doing now. Could you maybe go into a little bit more detail about maybe what led you to participating in this program that IPHCA has hosted in the past, and kind of what sparked your interest and led you to pursuing a career in an FQHC?
Absolutely. So I think my interest, I'd always known I wanted to go into primary care in some regard. I really like the variety. I like developing connections with patients, and I love that continuity of care of being able to, see patients kind of throughout their lifespan. But one of my rotations while I was in PA school was at Cook County or Stroger. And in that rotation, I did see a lot of patients who were underserved or either uninsured, underinsured, and just had kind of high medical needs. And that was one of my favorite rotations. It was incredibly rewarding to be able to help provide services for those patients. So that kind of sparked my interest in working with more underserved population. And from there, my program connected or told us about IPHCA, and that's when I kind of became involved and helped utilize IPHCA to actually help get my eventual job.
What she's referring to, if you aren't familiar, is that IPHCA does run our complimentary recruitment service, and we're able to connect not only students that participate in this program, but any students that are interested in pursuing a career in an FQHC. But everything that you said, Samantha, I think is fantastic. Really, the candidates that I speak with that I know are well suited for careers in an FQHC are the ones that have sort of that mission-driven philosophy behind, why they went into their line of work, whether it's dentistry or being a physician assistant or a counselor or whatever it may be. So it sounds like you're really the perfect place for you. And it sounds like you're really making a big impact. So those things that you were looking for in your career, would you say that you found them? You know, what do you like about working at PrimeCare? You know, how's everything going?
Absolutely. I think it definitely is checking a lot of the boxes of what I was looking for. Again, I love the variety. I love the patients that I work with. I have a lot of opportunity to work with Spanish-speaking patients, and I am bilingual in Spanish. And so it's very rewarding to be able to offer services for patients in their native language, which I think is very important and doesn't happen enough, unfortunately. So that's very rewarding. It's also just wonderful being at an organization where all of my colleagues have that similar mission-driven force behind them of really wanting to be there to serve our patients. And, you know, in healthcare, that's really what we are here for. And I think in FQHCs, that really makes that possible. You know, our mission statement for my organization is we serve everybody regardless of their ability to pay. And our goal really is to provide that high quality medical care to patients who unfortunately have not gotten it for most of their lives.
That's great. That's amazing. So a little bit more about, I think that's great that you speak Spanish. I don't think that I was aware of that. That's fantastic. That's really, really major for, you know, the setting in which you work. But I'd also like to hear more about providing MAT. So do you have any advice? There's probably some people watching this that are considering getting waivered or becoming an MAT prescriber when they get into their career. You know, do you have any advice for them, or, you know, maybe if they had any concerns or they were nervous about going into that, or, you know, what advice would you give someone that was maybe thinking about it, you know, maybe not sure if that's something they wanted to do?
Absolutely. So my first advice is to definitely get waivered. You can take all of the, you know, PAs or NPs can take those online courses, you know, prior to having a job or a position specifically. Just getting that knowledge on how buprenorphine works, how OUD treatment works in general, and what the options are will help you regardless of whether you go into a field where you will be treating MAT or using MAT specifically. Because honestly, you know, we all see patients with addiction, whether that's opiates, alcohol, various other substances. So these are patients that you will see in your line of work, regardless of what line of work you go into. And I'd also encourage just, you know, having an open mind and, you know, treating addiction as a disease, the disease that it is. It is a very rewarding field, treating opiate use disorder. You get to see very wonderful transformations in people's lives once they get access to the care that they've needed. So my advice is get your X waiver. If you are going through rotations and you have the opportunity to, you know, observe or work with a provider who provides MAT services, definitely go for it. That exposure, even just being able to ask patients about their substance use, is incredibly valuable and will definitely help you in whatever field you go into.
That's great advice. Just it sounds like it just can only make you a more well-rounded clinician, no matter whether that's something that you focus on heavily in your practice or not.
Absolutely.
I think that's a great way of looking at it.
Yeah, and there are a lot of volunteer opportunities as well in the Chicagoland area. So, you know, regardless of what your interests are, if your interests are in primary care, serving the underserved, there's tons of clinics that you can volunteer in. There's tons of addiction related services that you can provide as a student with volunteer work as well.
That's great advice as well. And I would just love to know if you had any other advice for current students that are watching this and, you know, planning their career, coming up on graduation, getting ready to apply for jobs. Just any advice that you wish that you would have known.
It's a great question. I think just taking advantage of being a student in that you have the opportunity to get exposure to a lot of different fields, a lot of different practitioners. I think just, listening and learning from everybody you see, and just kind of trying to be that sponge at this stage in your career, so that once you go into your role as a clinician, the more experience you have to draw on, the better. And I think, again, as you mentioned, Emma, really making you a well-rounded clinician, seeing more, being exposed to more things can help develop that.
That's great advice. And is there anything else that you would like to add? Anything about you specifically, anything that you're doing at PrimeCare that's really interesting that you think people would want to know about? Really anything. I'll just give you an opportunity to just add anything that you would like at this point.
Yeah, I mean, I think, right now we're living in a very COVID-19 heavy world. So, regardless of what area people go into, they are going to encounter COVID-19. And we have seen a huge disparity in the impact of COVID-19 on our underserved population. Another opportunity that I've had at PrimeCare is I do sit on our COVID-19 committee. And so we have a specific committee that really focuses on testing, updates on vaccine recommendations, all of those types of things. So, knowing, even though as a student, sometimes it can feel like there's a lot that's changing and you're already trying to absorb a lot of information, but COVID-19 is not going away. And so I really encourage everybody trying to stay up on recommendations for that. And in your current or in your future role, looking for other opportunities to get involved within the organization outside of your clinical work can also be very rewarding and provide a lot of variety in your day-to-day.
Something I really noticed throughout the COVID-19 pandemic is that an advantage that community health centers have is that they have that trust with their patients. And it was especially in the beginning and kind of throughout, it's been a scary time, everything from, when we first found out about it, no one knew, what the impact of it would be, and getting people to trust, with the vaccine rollout efforts, and I think that that's something that community health centers like PrimeCare have done especially well. So I do want to say thank you for your effort in that aspect and on the front lines of COVID-19.
Well, thank you.
We really appreciate you.
Thank you.
Yeah. Well, and that is all. I will be respectful of your time. I know that you're very busy. And if you have nothing else to add, Samantha has been generous enough to let me share her contact information with everyone. So you can feel free to follow up with her if you have specific questions about just being a clinician in a community health center, MAT services, or PrimeCare. You can feel free to reach out to her. And as always, that you can reach out to me, since we spoke a little about the recruitment service at IPHCA. So there'll be a session on that in this program, but just a quick plug for that as well. And that's all I have for today. Samantha, thank you so much for joining us. We really appreciate it. And again, thank you for everything that you do.
Thank you.
All right. Thank you. Bye-bye.